right, welcome back, everyone. In this part of our high-yield review on the influenza virus, we're going to zero in on the stuff you absolutely have to know for your exams. We're talking clinical picture, diagnosis, treatment, and, of course, prevention. So let's get right into it.
So here's our game plan. It's pretty straightforward. First, we'll look at what a flu patient actually looks like. Then, we'll head over to the lab and see how we confirm our suspicions. After that, we'll cover the drugs we can use to fight back, and we'll wrap it all up with the really crucial strategies for prevention. Okay, first up, the clinical picture. What does influenza actually look like when it walks into your clinic? Well, it can be anything from a simple flu to some really serious, life-threatening complications. Now, your classic uncomplicated flu, it hits you fast. We're talking an incubation period of just 1 to 3 days. In an exam question, you want to look for that abrupt onset of symptoms, the chills, the headache, a really nagging dry cough, and a high-grade fever. And that deep muscle ache, the myalgia, that's a huge hallmark feature. Now, remember, for most healthy people, it's self-limiting. The body fights it off. Okay, for your exams, this is where the money is. Complications are a favorite topic, so let's use a mnemonic to lock these in. My rare pneumo. My is for myositis or myocarditis. R is for Ray's syndrome, and you absolutely have to remember that link to giving aspirin to kids with a virus. A is for asthma exacerbation. The next R is for rhabdomyolysis, and E is for encephalitis. And the grand finale, pneumo, stands for pneumonia, and you need to know that secondary bacterial pneumonia is the #1 most common complication of the flu. This mnemonic covers all the big ones they'll ask you about. Pay attention, because this table is pure gold for your clinical scenarios. These are the Indian government's guidelines for H1N1, and they tell you exactly what to do. So look at category A, just a mild illness. What do? Nothing fancy. Home isolation, no tests, no antivirals. Simple. Category B, things are a little more serious. Maybe a high fever or it's a high-risk patient. Still no tests needed, but now you might think about starting Oseltamivir. But category C, this is your emergency. The patient is breathless, has chest pain, low blood pressure. They need to be hospitalized immediately. You need to run lab tests. And this is the crucial part. You start Oseltamivir right away. Don't even wait for the results. So you've got your clinical suspicion. Now how do you actually prove it in the lab? Let's jump into section 2, laboratory diagnosis. It all starts with getting the right sample. It's that old saying, garbage in, garbage out. The best specimen is a nasopharyngeal swab. And look at the details here. The tip has to be synthetic, polyester, or Dacron. Why? Because cotton swabs can actually inhibit the test. And as soon as you take that swab, it has to go straight into viral transport media. These little details are easy marks to pick up in an exam. So, if you get a question asking for the single best, most sensitive, most specific test for influenza, there's only one answer you need to know. The gold standard is real-time reverse transcriptase PCR. It's the best because it detects the viral RNA directly. And this is what a positive result actually looks like. Don't get intimidated by these graphs. On an RT-PCR chart, all you're looking for is that rising S-shaped curve. If you see that curve going up, it means a specific viral gene has been found and amplified. So here, you can see clear positive curves for H1N1, H3N2, and influenza B. And that flat line at the bottom, that's a negative result. Simple as that. This table just breaks down the logic for you. The test is smart. It runs multiple reactions at the same time. So to be called A/H1N1, the sample has to be positive for the general influenza A gene and the specific H1 gene. To be A/H3N2, it's got to be positive for influenza A and H3. And if all the A stuff is negative, but the influenza B gene lights up, well, then you've got influenza B. It's just a simple process of elimination. Okay, we've nailed the diagnosis. Now what? How do we fight this thing? Let's talk about treatment. If there is just one thing you remember about treating influenza, let it be this, the 48-hour rule. For these antiviral drugs to really work, you have to start them within 48 hours of when the symptoms first appeared. After that window, the benefit drops off a cliff. This is a super common exam scenario. You've got to know the two main drug classes. On one side, we have the neuraminidase inhibitors, like Oseltamivir. These are the current drugs of choice, and the great thing is they work on both influenza A and B. On the other side, you've got the M2 inhibitors, like amantadine. These are pretty much history for seasonal flu now because there's so much resistance. Plus, they only ever worked against influenza A anyway. So for your exams, the answer is neuraminidase inhibitors. And here's the specific dosing for Oseltamivir that you just have to memorize. If you're treating someone who's actively sick, it's 75 milligrams twice a day for 5 days. But, and this is a key difference, if you're using it for prevention after someone's been exposed, what we call chemoprophylaxis, the dose changes. It's just once a day, but for 7 days.
All right, let's move into our final and honestly, probably the most important section, how we stop influenza from spreading in the first place. Let's talk about building our defenses. I want you to think about prevention as a 3-layered strategy. The first layer is just general public health stuff. The second and most important layer is vaccination. And that third layer, which we only use in very specific situations, is chemoprophylaxis. For those general measures, here's another easy acronym for you. COVER. C is for covering your coughs and sneezes. O is for observing strict hand hygiene. Wash those hands. V is for vaccinating every single year. E is for equipment, like wearing a mask. And R is for restricting contact. If you're sick, stay home. It's basic, but it really works. Okay, this is a guaranteed exam question. You have to know the difference between the two main types of flu vaccines. The injectable shot, the IIV, uses a killed virus. It's given as a shot in the muscle, and it's safe for pretty much everyone over 6 months old. On the other hand, the nasal spray, the LAIV, uses a live but weakened virus. It's sprayed up the nose, and it's only for healthy, non-pregnant people between 2 and 49 years old. All right, here are some quick-fire facts about the vaccine, perfect for your multiple-choice questions. They can be trivalent, meaning they protect against 3 strains, or quadrivalent for 4 strains. The formula is updated every single year based on what's circulating around the globe. You should get it before flu season really kicks off. And this is important. Its effectiveness changes every year, and the immunity you get only lasts about 6 to 12 months. That's why you need a new shot every year. And finally, that third line of defense, chemoprophylaxis. Now, big red flag here, this is not for routine use. You only use it in very specific situations, like for a high-risk person who's been exposed to the flu but isn't vaccinated. It's also a tool for controlling outbreaks in places like hospitals. And the drug of choice? You guessed it, Oseltamivir, once a day. So, let's bring this all together. The big story with influenza is that it's constantly changing through antigenic drift and shift. It's a moving target, and that is exactly why we need a new vaccine every single year. If you take one thing away, remember this. Annual vaccination is our single most powerful weapon against the flu. And that leaves us with a pretty big question, doesn't it? We're up against this virus that's a master of disguise. Is our best strategy really just this yearly race to keep up with a shot? Or are we getting closer to a universal vaccine that could protect us for longer? It's definitely something to think about as you continue your studies. Okay, that's it for this review. Best of luck with your exams.